Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Vamos, Rafa! So if you're a tennis fan and if you've been staying in tune with the Australian Open, my idol, Rafael Nadal, is out of the Australian Open with a hip flexor injury. Today we're going to be talking about treatment solutions for this common injury that we see every day. You're not going to want to miss this one, so stay tuned. Dr. Mike, you know what a big tennis fan, you know what a big fan I am of Rafael Nadal, Australian Open. He's out with a grade 2 hip flexor injury. So this is not just a tennis injury. We see this with all sorts of athletes, even runners. What is a grade 2 hip flexor tear?
Yeah, well, the grade is the aspects of identifying the severity. So a grade 1 would be more of a mild tear or strain. Grade 2 gets a little bit more damaged tissue. Grade 3 or 4 really comes to the actually separation or a complete disruption. So really a grade 2 tear really describes a mild to more moderate degree, and it's not to be taken lightly, but it's telling us this is not just something that you can kind of, just shake it off for a couple of days and you'll feel better.
Right, and the hip flexor, that's an important muscle, obviously. The hip, but also the core and the lower back. Anatomically, it's a very deep muscle, right?
Yeah, the deep muscle. The muscle attaches way into our spine, deep inside, and the tendon runs across the hip joint and attaches to the bone below, and our femur pulls the leg up so it flexes the hip, such as we call a hip flexor. But anytime you just go up a set of stairs, people who crouch and bend a lot can strain their hip. And of course, all our, people who are trying to encourage our patients to be active, getting back out in the new year, running, jumping, and doing some calisthenics, all could potentially strain their hip flexors.
Yeah, and if you've suffered this type of injury, definitely comment in the line below. I'm expecting Nadal, he's going to be out for what? About
it's a good 4 to 6, 8 weeks sometimes with this type of injury, because again, he's got to go back to high level. It could be a while.
And I know for a fact he's a big fan of regenerative medicine, similar to our practice, where we combine medical care, physical therapy, and chiropractic under one roof. We utilize cutting-edge treatment options like regenerative medicine to help augment the body's response to injury and speed up the recovery, right?
Yeah, we're trying to repair those damaged tissues, and that's what it does. It takes the blood supply, gets our body kind of responding nicely, and then we actually can repair those damaged areas.
And if you're suffering from anterior front pain into the hip, you're definitely going to want to give our practice a call. More information can always be found on the web at maragalmedical.com. We have a wealth of information on our YouTube channel, and please consider subscribing. Remember, folks, we take most insurances. Well, that's it for today. I hope you learned something. Have a great day, everyone.
Bye now.